If you're a clinician who treats musculoskeletal patients, you might ask yourself why you would need to learn neurology, beyond, of course, for detecting and referring for serious pathology. However, the understanding of chronic pain has evolved tremendously over the last 15 years, and you'll find many papers on this subject in the literature, of course. But my favourite title of all the papers that I've read is this one. Chronic musculoskeletal pain is a nervous system disorder. Now what? I particularly like the now what, because it really means that anyone who wants to be a chronic musculoskeletal pain specialist has to understand the nervous system. It's no longer, and never really was, sufficient to simply look at tissue damage or inflammation as the cause of pain. Now, of course, tissue damage in terms of an acute or a repetitive injury can contribute to pain, and so do things like inflammatory arthritis or polymyalgia rheumatica. But what about the many patients who have chronic pain without obvious tissue damage, or in whom the tissue damage that they did sustain should have healed up a long time ago? And what causes repetitive tissue overload and pain in some people, whereas others who do exactly the same activity or exactly the same job have no pain? So this is where we need to look at the nervous system. We need to understand how abnormal pain modulation and central pain sensitization can contribute to chronic pain. And we need to know how movement abnormalities and insufficient postural stabilization can contribute to both acute and chronic tissue damage, but also negatively influence the systems involved in pain modulation. Tissue damage can, of course, contribute to movement abnormalities and also abnormal pain modulation and sensitization. But fixing tissue damage and inflammation just on their own doesn't necessarily reverse the unfavourable neuroplasticity that's occurred in the nervous system. And this is where we need more specific neuromuscular rehab strategies. Now, naturally, patients who have pain sensitization or are not moving well, they will usually have a more sedentary lifestyle. But unfortunately, this in itself causes more systemic and neuroinflammation. There's been quite a lot of research lately confirming this, that if you don't move, if you're not regularly physically active, your inflammation levels, both in the muscles, systemically, and also within the nervous system, are generally higher.